Hi, my name is Christina Magnelli-Reyes, and I'm from Cleveland Clinic, and I'm here with Dr. Ayman Hussein, and he is a cardiac electrophysiologist, and he is our director of cardiac research and director of the AFib Center at Cleveland Clinic, and we're going to talk to him today about PFA, pulse field ablation. Thank you for coming, Dr. Hussein.
Thank you, Christina. My pleasure to be here.
So I was wondering if you could explain to us a little bit about what pulse field ablation is and why it's important now to our patients. What does it mean and why is it important?
So pulse field is the new technology or energy source that we're employing in ablation of cardiac arrhythmias. The main difference compared to our previous energy sources is that this uses high voltage electricity to eliminate electrical activity, whereas our traditional ablations usually employed either heat or cold, so we call them thermal energies. So we used to either freeze the tissue or burn the tissue, basically to suppress arrhythmias. Now we are using electricity to suppress the electricity.
And so what difference does that make for the patient in after an ablation? Is there any difference to how the patient would feel or how the patient will respond to an ablation?
Yeah, so the main advantage to this is that it is delivered in a way that is very selective to the tissue that we're targeting. Whereas thermal energy traditionally, which was traditionally used, did not differentiate or doesn't differentiate between the targeted structure and the nearby structures. As such, there was some risk of collateral injury or damage. The risk is much less with pulse field ablation, and that's why pulse field ablation is increasingly used, primarily because of the safety profile. Not only that, but it's also very efficient, and the procedures got much shorter, which means less time under full anesthesia for patients. Okay, so these are the main advantages. Some additional advantages in terms of workflow and recovery include less likelihood of inflammation around the heart, us being able to send patients home same day, sometime following day, but usually because of the safety profile, we feel more comfortable sending patients home same day.
So I know in the past, sometimes we would talk about, doing antiarrhythmic treatment first, maybe waiting it out, seeing how patients feel with symptoms before we would do an ablation. Does this kind of change your thoughts about ablating sooner now that we have this safer technology?
Yeah, that's a great point. Traditionally, ablations were done when or after antiarrhythmic medications failed, but progressively we're doing more and more cases in patients early on in the course of their AFib history, primarily because we've seen the benefit of early control of rhythm, but now we have this safer strategy, which makes even a stronger case for early ablations. So the benefit is twofold: safer procedures, yes, so being able to do more patients, but early interventions typically result in better outcomes when compared to antiarrhythmic medications.
And how about patients who might need a redo procedure? If they've had a previous procedure, maybe with radiofrequency or cryo, or even with PFA, how do you manage that?
Yeah, so generally speaking, we prefer redo ablations over antiarrhythmic medications for patients who fail a first ablation procedure. And we've shown that in our own research that patients who fail a prior ablations are better off served with redo ablation versus medications. Pulse field ablation would be a good strategy for redo interventions for the same reasons, which is the safety. So even if they had their prior ablations with radiofrequency or cryoablation, meaning the heat or the cold, most of the time the recurrences of atrial fibrillation are related to reconnections of the ablation sites. So we would go back, map those out, and then target those areas. And for the most part, this allows better rhythm control in these patients.
Awesome. So what do you see for the future, kind of down the pike for PFA?
So there are a lot of interesting, investigations and products being developed, both for ablation of atrial arrhythmias, meaning atrial fibrillation and things alike. And in the pipeline, we have products that could target ventricular arrhythmias, which are arrhythmias that are coming from the bottom chamber of the heart. The benefits are still the same, the safety profile, but we have also some information, some data that those PFA tools can deliver bigger lesions and allow us to do the ablations fairly quickly without having to deliver a lot of volume, which means possibly safer and shorter procedures for patients. There are a lot of tools being developed to allow the operator to target certain areas more precisely. But most importantly, there is interest in developing new techniques in terms of mapping and allowing both mapping and ablation to be done with the same catheter. So a lot of exciting stuff in the pipeline, and such an exciting time to be an electrophysiologist.
Right, and it's such a great time. We've seen, this be, well received by physicians, and it's great for the patients as well. And it's really an exciting time in our field. So
it is an exciting time, and it's still at an early stage, but with a lot of promising data and outcomes. Sure. And we are so looking forward to what the future holds for this.
Absolutely.
Yeah.
All right. Well, thank you so much.
Thank you so much, Christina.
I appreciate it.
Thank you.
And thank you so much, everyone. And this is UpBeat TV, and we'll see you next time.